Welcome to Dr. Brumfield's Elite Athletics. I am Dr. Brumfield. All right, welcome back to the second part of the video. We've talked about sciatic nerve, sciatica, piriformis syndrome, and now I have a patient who's experiencing some of these, and we're going to figure out what it is. This is Alicia. Welcome, Alicia. How are you?
I'm good, thank you.
Good. So tell us why you're here. Oh, I'm sorry. By the way, I'm Dr. Brumfield, if you didn't see the first part. All right, let's go.
Well, I'm here because I have lower back pain, and I have a lot of shooting pain that comes down my back, all the way down to my lower leg. Sometimes I have some tingling in my feet and my toes, and it does happen on some side, like one side one day and then the other side the other day, so it is sporadic. It's not the same side all the time. I do exercise probably 3 days a week. So I am pretty active, so I'm not really sure why I'm experiencing.
Sure. So let me ask you a few questions. So in the morning, when you wake up and the first thing you get out of bed, do you feel it?
I do, yes.
You do feel it, okay. When you sit for a long period of time, do you feel it?
I do.
Okay. Is it on, so we don't know, is one side more than the other, or is it 50-50, or how would you say?
Maybe about 60-40, a little bit more on my right side.
More on your right side? Okay, so basically what we're gonna do, or what I'm gonna be doing, I guess, is going through like 2 or 3 orthopedic tests to kind of narrow down if it's a disc or the nerve root that we talked about previously in the previous video, or is it the piriformis, and we'll go through that assessment as well. So basically what we're gonna do now is we're gonna do a test called the Kemp's test. So what I want to do is I want you to look over your left shoulder, Alicia, as far as you can. I'm going to turn you this way, and then I'm going to arch. You feel any pain that way?
A little, yes.
A little bit? Okay. Now we're going to go to the right side as well. Turn your head over the right. I'm going to turn you this way, and I'm going to tilt you as well. Any pain?
Yes.
How much?
A little bit more on this side than the other.
A little bit more on that side? Okay, so what we've done was the Kemp's test, and that really tells us if it's a disc that we're dealing with or a nerve root. And so she has a little bit of pain. If it was a lot of pain, then we would know without a doubt that it is the nerve root. So go ahead and lay on your back for me. On your back. All right, and so as she's laying on her back, the first thing that I'm going to do is I'm going to lift her leg. Any pain there?
Yes.
Where's the pain? In the back of the thigh. And so this is called a straight leg raise. And then what I'm going to do is I'm going to pull her toe down. Any pain there?
Yes.
Where's the pain?
Now it's stretching more up to the...
Still in the back? Okay, good. So we're going to do the same thing as we did on this side to the opposite side. I'm going to do straight leg first. Any pain? Just a little bit. Toe down, a little bit as well. Okay. Now, what I want to do is I also want to check her hips, because as we talked about, and I know you can't see me, but as we talked about also, the piriformis muscle is attached to the hip as well as the sacrum. And so what I'm going to do is I'm going to basically do a stretch to see how tight. This is called the Patrick's test, and just to see any pain or discomfort.
Yes.
So she's tight in her hips. We're going to stretch up to the other side as well. As you see, this side opens up a lot more than the right side. And so the right side is actually the side that she's having most of the pain or discomfort on. Let's get you up. And right now we're going to turn you over onto your stomach. Okay. So from this point, what I'm going to do is I'm going to assess her hips. And from this position, her right hip is higher. Now I'm directly on the sacrum. And so what I'm doing is I'm manually moving the sacrum to see what side is sticking or what side is soft. And then from here, you go from the sacrum to the hip bone and directly in the middle, and you push. Okay, is that tender?
Yes.
So it's a little tender there. And that's directly over the piriformis muscle. Same thing here. And how's it feeling here?
Yes.
And this seems like it's a bit more, okay, a bit more tender. All right, so what we know now is she's really dealing with more of piriformis syndrome rather than the sciatica syndrome that we talked about, right? So, so what we're going to do is we're going to, actually I'm going to slide her over a little bit. And the first thing that I want to do is I'm going to do the stretching for her first, and then I'm going to give her some stretches to do on her own. So I'm going to lift the leg here. And so basically what this is doing is I'm contacting the outside of the sacrum. So if you contact the glute and slide up, you're going to run into a bone, this triangle shaped bone. Hopefully you can see it there. And then I'm just stretching the leg. Nice and slow. Nice even stretch. Hopefully you can see it. And then what I'm doing is stretching out the SI joint as well as the piriformis muscle. Okay, so this is something that you would have to have someone to help you do on your own. And sorry for the camera view, but I got to do it on the opposite side. So again, same area. Okay, so basically I'm going to find the same landmark, the outside hip, base of the sacrum. I'm going to place my thumb there, and I'm placing downward pressure. We're going to lift your leg, and basically what we're going to do is we're going to gap open the SI joint, stretching the piriformis muscle. We're going to move it around to the base of the sacrum as well. So again, like I said, from the right side, you're going to need someone to kind of help you with this particular stretch. This stretch will help you with piriformis syndrome because, again, it's a small flat band-like muscle and it doesn't take a lot to stretch. The unfortunate part about it is once it is tight, it takes a lot frequent stretching to keep it, pliable and loose. What I'm going to do is transition into the stretches that you can do yourself at home. So the first stretch is your right side is the one that's most effective. So let's start with your left side. Go ahead and lift your left leg, and let's go ahead and bend it and grab it with both hands. Now the important part of this is we want your chin to be tucked flat and pull all the way up and hold that tight for 15 seconds. Now, do you feel that in your lower back?
I do.
You feel the stretch? Okay, so you hold it. Okay, good. Now we're going to do the same thing on the other side. So lift the leg all the way up, grab it, tuck your chin as well. Flat chin equals flat back. Pull it constant. You feel it in your lower back?
I do.
Good. Don't forget to breathe. Let's see you holding your breath. There you go. Good, good. And now we're going to put this leg back. And now what I want you to do is to grab both legs and bring them forward. There you go. Tucking your chin also. Yeah, you feel it, huh?
Yes.
So hug yourself, pull them tight. Chin is tucked, so that's nice and good. Good, good. Okay, so now let's go into the next phase of this. So now what you're going to do is right side is the effective side. So this time we're just going to bring the right side down flat on the table. We want to bring the left leg over and cross over. So now this is going to directly stretch that piriformis as well as the glute max, glute medius, and the glute minimus, because all of those can also give you the same sciatic nerve type of problems, right? So we're going to grab the thigh, one leg on that. There we go, perfect. Tuck your chin. Good. And so as you're doing this, you notice the leg that you're actually stretching is this side here, the one that's bent. So you're going to feel that all in your glute area. So you're going to hold it for 15 seconds. Keep breathing. Good. Chin is tucked. Excellent. Let's switch. So just go right into the, no, put the legs completely down. Now let's come all the way back up. There you go. Perfect. Yep. We want to make sure our technique is right so we don't skip any steps. Oh, I see the look. Tuck your chin. How does that feel?
Feels good.
Painful.
Yes. I can feel it.
I know this is your effective side, so I'm going to help you just a little bit. Tuck the chin. There we go. And as you notice, she's sliding more into the stretch, which actually helps with, keep breathing. There you go, which helps to pull all of this apart. Perfect, perfect. Now, we've already done the adjustment on her, and then the last part of this is what I'm going to do is actually put her into the DrOhMyBack boots. That's going to help with the glutes as well as the piriformis muscle. All right, so now what we're going to do is we're going to actually put her in the DrOhMyBack boots for the lower back. So go ahead and lift that leg for me. I'm gonna slide this up. Perfect. Give me this leg. We got another pair of boots over here for you. And we're gonna slide all the way up. So I need you to lift up for me. Lift up a little bit more. All right, now we want to slide all the way up. Lift for me. 1, 2, 3. Perfect. Good. And so now, what the DrOhMyBack does is it helps you with relieving lower back pain, relieving stress muscles, as well as it's great for recovery. And so we're going to just get it strapped in and get it set up and make sure that we're covering the affected area, and we are. Get the compressor, so we need to get it hooked up. If I can remember how to do it. There we go. That is a joke, though. I actually know how to hook it up. All right, and so now with the DrOhMyBack, let's go ahead and spread your legs just a little bit, right there, perfect. So we're gonna cut it on, and I'm gonna lower the level first. And so basically what's gonna happen is, give you some room to expand. So it's gonna increase in tension in the thighs first, and then once those are filled, then it'll go to the lower back, giving the compression and the relaxation, which will help with the piriformis muscle, with the glute muscles and all that. So you're feeling the tension?
I am, yes.
How does that feel?
It's good.
Good. And so with this, we would leave her on for anywhere from 10 to 15 minutes, depending on how severe she is. As you see now that it's compressing, the legs are done now. If you notice here, it's going to the lower back. And so Alicia, instead of just having your hands hang, let's put them up here, so we don't want to cause another issue that I may have to correct. How does that feel?
Tight.
Tight? Yeah, good. And so by the time that we release this, she'll feel relaxed. The glutes won't be as restricting as they were. And then she'll feel kind of a euphoric feeling as well. First time to our channel, we would like to say welcome. If you're returning, thank you so much for the support. Don't forget to hit the subscribe button as well as the bell up there for the notifications.